Academic medicine is really the engine of discovery, the engine that makes healthcare better. I like to think of academic medicine as a three-legged stool: research, education, and clinical care. What we do with these three things is combine them with the grand objective to make healthcare for the American people better. Part of academic medicine is both the infrastructure and, of course, the people. Basic scientists, physician scientists, physician educators. In our case, we're affiliated with Banner Health, which offers us tremendous capabilities to actualize and translate our research from the laboratory bench to the patient's bedside. Patients that have no standard of care options can come and potentially benefit from novel technologies and novel treatments that are being explored through clinical trials. So that's one benefit, and a major benefit. Another benefit is the fact that the faculty at an academic medical center are generally involved in some aspect of research or education. And in addition, many of the faculty are leaders in their fields. You can immediately understand that if you have a physician like that is taking care of you, that you're going to get the best possible care. So let me give you an example of academic medicine at work. So you have a fundamental scientist working in a laboratory on the question of discovering the genes in a cancer cell that make that cancer cell more resistant to certain chemotherapeutics that we use right now in the clinic to treat cancer. That scientist then discusses these findings with a physician scientist. That physician scientist does a number of experiments, including discovering drugs against this molecule. Then they take those drugs and do a clinical trial with the new drug in combination with the chemotherapy. And if everything has been right so far, the chemotherapy now works a lot better by virtue of inhibiting that gene with the small molecule that was discovered. Without academic medicine, we would not have the advances that we've seen in the last 20, 30 years in cancer, infectious disease, neurology, etc., being able to make discoveries in the laboratory that then are actualized, or what we call translation. They're translated to healthcare and then become routine healthcare. That is really the heart of academic medicine.